Welcome to Grandpa Hill's True Health Stories. In this case, I think a lot about my health, do what I can, and then laugh and live. Or to put it in the words of the priest that recently heard my confession in Norfolk, Virginia, be grateful for what you have. Do what you can regarding the troubles in your life and in the world, and leave the rest to God. So for this Grandpa Hill's True Health Story, I am grateful for what I have, and I have done most of what I could have done regarding COVID-19 and me. My gratefulness is in the biggest way driven by what happened to me due to COVID-19. It made me healthy. The healthiest I've ever been, even healthier than when I was a teenager. My measure of healthy is not getting fevers, not getting the flu-like symptoms, not getting congested in my chest, not getting my ears infected, and not getting nausea and losing my stomach. Part of my every year, year after year, for 66 years, and sometimes twice in a year, and even 3 times a year, I would get sick with some of those symptoms. So sickness measured that way for me has gone to 0, nada, and I am grateful. So with the COVID-19 pandemic, I also got depressed. How the government health agencies reacted, how Big Pharma reacted, and how my own Catholic Church reacted. Responding, in my opinion, according to the facts and according to the faith, quite poorly. But as the priest indicated to me, I can't do much about those things, even if they're stupid or bad or evil and even immoral behaviors of others. I can, though, take care of me and do my little part for the rest of the world in sharing with you what happened to me. So the main point of this story is that I am healthier since COVID-19, and I will share why I think I am healthier. This is what truly happened to me and what I truly do in my response to COVID-19. Yes, I was afraid for myself at the beginning, and afraid to spread the disease. And I started to see some kind of strange and kind of ugly things happen. There was just no way I would do what Kenny was told to do. Like so many office mates, he went to the Medical Express people. He was sick. He took a test. He was told he had COVID. What do I do for it? The answer, just go home. Isolate yourself. Try to get over it. If you develop breathing problems, go to the hospital. That seemed like terrible advice. In other words, when you came in with a respiratory infection that you would get routine treatment for, such as antibiotics or cold remedies or anything like that, instead you're told just to go home. Come back when you're really sick. I had heard on the internet that this was happening. No basic care, no early treatment, and no prevention. People that spoke of prevention or early treatment were viciously attacked and made fun of in the press, including our own President of the United States. So in those first few weeks, I spent time being ungrateful, practically forgetting and despairing about the future, and forgetting or ignoring the very exceptional and good life I had and was continuing to have. Mental health note. When you don't leave anything to God and you still care, well, then you have to handle it all. And well, that is in one simple word, overwhelming. So that is behind me. I am grateful for my life, my health, and the life and health of my children and grandchildren. So how healthy am I? Prior to COVID, I got sick just like everybody else, and probably even worse, and on a fairly regular basis. Since COVID-19, not sick so much. Really not at all. Others seem to get the flu. When they used to get the flu before COVID-19, I would get the flu. Now, no flu symptoms since 2020. I would certainly have had a bad cold every year with fever and aching and chest congestion and breathing issues. Last fever I got was in January of 2021. It was for just a day, and the following day I was up and at it and ready to work again. At work during 2020, 2021, 2022, and 2023, the workers and staff seemed to get sick, get tested, and stay home for a required number of days. They typically get tested and determine they are sick with COVID. They miss work for a day or several days. Many have been sick with a positive COVID test twice a year. Many of those that got sick had been vaccinated and boosted. In fact, I recall overhearing one of the managers over the phone talking to Kenny. He had a strained and difficult voice, obviously with a significant illness. He said, and I paraphrase, "I got vaccinated. I got all the boosters. I wore my mask every day. And I am so sick. I just don't get it." So these are the three things I did that I think prevented, mitigated, and stopped my respiratory infections during and since COVID. 1, I boosted my immune system, and the key ingredient to that was D3. Number 1, prevention, in my opinion. Number 2, I conduct saline and dilute iodine nasal rinses. This has been the best for me for the immediate reduction of viral load. And 3, I took ivermectin, and I will take ivermectin when I developed significant congestion and was not progressing with the nasal rinses. If I did nothing else for my immune system and just did D3, I think I would be about as healthy as I am. Not sure, so I also supplement with vitamin C and some zinc. For being prepared for the next illness, vitamin D would be my go-to supplement. I thought critically about causes and remedies and treatments early in 2020. The low vitamin D that was associated with higher levels of death. It wasn't stated much, and you had to dig around a little. You had to listen to the doctors that were brave enough to speak their mind and follow their conscience on treating COVID. So I studied and noticed that the comorbidities had something in common. Comorbidities: old people, obese people, diabetics, smokers, and darker-skinned people. What do they all have in common? They all struggle to maintain healthy D3 levels. I ended up getting Mary's and my vitamin D up into the 70s and 80s. I don't remember the units on that, but it's whatever they would be using in the United States. At the time, we did a Grandpa Hill's True Story, Vitamin D3 for Me and Mary Lee, about our success in getting our vitamin D up. Dr. John Campbell of YouTube fame also reported out on a famous study out of Israel that indicated that adequate vitamin D reduced the chances of death 14 times more likely to survive hospitalization for COVID if vitamin D was adequate compared to those with low vitamin D. Dr. Campbell was also kind enough to urge the use of vitamin K2 to mitigate any issues with too much calcium production from the excesses that might occur in D3. I took him up on that, and I do some K2 as well. One other prevention item that I would be remiss if I didn't say something about it was washing the hands and face and having a clean towel around to dry with. We have 4 families that regularly visit our home. We have a couple of dozen grandchildren. We go out in public frequently. We went out during the pandemic frequently. Among other things, we washed our hands a lot and used sanitizer and kept changing the towels. This probably helped stop our spread of viral load and bacteria spread more than the masks could have ever done. We accepted that we would quite likely come in contact with viruses every day of our lives and wanted to be as strong and ready for them as we could be. That's the vitamin D3 and other supplements, and cleaning up your hands and frequent changing the towels all came together. Then on number 2, the nasal rinses, I think my primary reference on that would be a Dr. Peter McCullough. He had a lot to say about risk assessment and the vaccine. He's a heart doctor. And I already had heard enough about the vaccine injuries that were popping up, being denied that they were happening, and yet still the vaccine was being pushed by everybody, including the government. Now, it made no sense to me. Yet even my employer was pushing for vaccines, and so was the Catholic Church recommending them, even going so far as to say that it was stupid or foolish not to get vaccinated. So the vaccines were never really considered by me. They were developed on the backs of aborted babies. That made me ill to think of that syrup that was only possible through the deaths of the babies to enter my body. So I wouldn't take them. So if a vaccine did make it past my moral concerns, I would then still have to study the risk. And people like Dr. Peter McCullough, he's like not a young man, and he's a heavily vaccinated man for all through his career, considered the vaccine a risk not worth taking. That's a good thing, I guess, but I was more impressed with how this Dr. Peter McCullough, among many others, was into cutting the viral load on his body, physically stopping the viral load. He introduced me to the process of reducing my viral load by rinsing it out of my nose and out of my mouth. I had, for about 20 years, been rinsing my nose with salt water whenever I would start into an upper respiratory infection. It had helped me to shorten my illness. Now here was Dr. McCullough relaying amazing results from India where the rinse and gargle was with a solution that had iodine in it as well. I modified the rinse solution some and started rinsing whenever I was going to be around the sick or when I was starting into a head cold. The results were fantastic for me. My normal progression from congestion to sore throat, ear aches, chest cold, and fever quit happening. So for 39 months, there hasn't been a single day of having a fever. I use a NeilMed nasal rinse bottle. It makes it really easy compared to using a baby bottle or a neti pot. So if I start to get congested in the nose, instead of saying it will get better or it is just my allergies, I get out the iodized salt, the iodine, the betadine, and make up a solution to my liking. I tend to use a half a teaspoon of salt in 8 ounces, and I rinse my nasal cavities. Then I add to the remaining 4 ounces about a half a teaspoon of betadine, which is 10% iodine, to the remaining 4 ounces. This I rinse with and then take the lid off my NeilMed squeeze bottle and gargle once or twice with the remaining solution. If the solution is a little distasteful, I will also gargle with scope or Listerine after that. The point of all this is to reduce the viral load. Less virus growing in my body makes it much easier for my immune system to fight off the virus particles that want to survive and multiply in my body. I cover this concept in my podcast about going virus hunting. I have not been vaccinated for COVID-19. The vaccine seems to be immoral, ineffective, and damages some people and may set others to get into future illnesses. Just not a good way for me to go. My risk assessment was similar to Peter McCulloch's. Nope, not for me. The more political the virus got and the more stupid the treatments got, that's when I got really scared about the government and no trust. That's not a good thing. When the emergency is real and the government says it is real and wants to help me survive a real crisis, my first response is, I don't think so. I remember how bad you were claiming masks were effective. Science and experience says no. How good the vaccines were, yet science and experience says no. Then how anyone who disagreed and spoke up about it, well, they were chastised and considered misinformers. The people trying to tell the truth were considered the deceivers. As an aside, I wonder, did I ever get COVID-19? For the population, the proof of COVID was a positive test. And if you go by that, I never had COVID because I never had a positive test. When I did think I had COVID in December of 2020, my new doctor said over the phone, and I'm paraphrasing, "No, not likely. Not enough symptoms lining up." I did not do the PCR test. I listened to my doctor. The same doctor had asked me, did I get tested? And I said, no, I don't think it's the right test. I don't think it works. And my new doctor, he agreed with me and said it really wasn't the right test for the COVID-19 virus. So that same doctor was chosen among many because he would, if he thought it warranted, address COVID-19 with ivermectin or even hydroxychloroquine. Despite the pressures from what I call protocol people, you know them, they follow the official popular sanctioned, not necessarily working theory or fairy tale or narrative, as they like to call it, and shut off everything else. This brings me to the third piece of my actions against COVID-19. Ivermectin. As I kept hearing of great improvements happening from ivermectin in Peshawar, India, a few doctors would keep getting kicked out of hospitals because of ivermectin. I needed to find out. So ivermectin is a protease inhibitor. It stops the replication of cells. And I think it stops the replication of virus. And this gives my body a chance to attack the virus. And the same concept is even being used with ivermectin and cancer treatments. Take the ivermectin, stop the growth of the cancer. Follow it up with cancer treatments to kill the tumor, which is weakened. It's not growing as much. So when I feel like I'm losing ground, this is my third one, and my supplements and nasal rinses have had no effect, I start taking ivermectin. I buy it off the internet from India and take it at the doses recommended by the FLCCC. That's the frontline caregivers for COVID. So far, it has been 3 occasions in 3 years when I got congested, didn't clear up quickly, and I took 2 doses of ivermectin, and in all cases, quickly recovered. It is difficult to find a doctor that will prescribe the ivermectin, and then when you did have a prescription, it was also difficult during COVID to get it honored. Where I live, we have chain store pharmacies like Rite Aid, Giant Eagle, Walmart. They wouldn't fill ivermectin prescriptions. I promote and do every bit of pharmacy business that I can at my local Keystone Pharmacy in New Alexandria, PA. There, the owner, David, knew firsthand the value of his service of enabling doctors to care for their sick and sometimes dying patients with ivermectin. He honored the prescriptions. He was not controlled by a big company or owners. He was the owner. Rather, he was controlled by his well-formed conscience. How could he deny anyone anything that a doctor thought would help? And definitely not going to be hurting anyone. David reported to me positive feedback from those prescriptions he was filling. People were at death's door and they were getting ivermectin, and then they got better and came home. No double-blind placebo study, just the truth and the experience that he was having. It didn't hurt people, and for many, it helped them. Yes, there were other pharmacies like Klingensmith's and Contanning, but they were rare. Anyone controlled by cash and bosses and not really interested in the health of their clients, well, they were and still are what I call protocol people. I try not to do business with them. And in a way, they got away with it. People still shop with them and love the protocol or herd thinking that was handed to them. So D3, nasal rinses, and ivermectin are my go-to actions against COVID. The masks, the vaccines seem to be so not worth it and ineffective. And those ineffective actions were the government's actions, the church's recommended actions, and my employer's actions. This led me to have a poor opinion of the integrity of those institutions. Did I ever get COVID? Well, my simple answer is nope, absolutely not. Didn't get it. So Grandpa Hill, with his regular supplementation of D3 and other supplements, with his nasal rinses at the ready, and his ivermectin on the shelf, along with his hydroxychloroquine, is ready for respiratory infection prevention and fighting. I am watching vigilantly for the diseases, and just as vigilantly, I watch for the ineffective and harmful actions of the institutions. Until the next Grandpa Hill's True Health Story, Shalom.